You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. And welcome to the ladies' room, everyone. Today we have a very exciting session. I want you to keep in mind one number, 55 million. Think about this during our entire coming conversation. 55 million is the number of women who could lose access to preventive healthcare services. Of course, that will not only harm them, but their families as well. And this is alarming for all of us. Our guest today, Beth Battaglino, RN, who is CEO of the nonprofit organization healthywomen.org, is here today to help us learn the facts. Facts are extremely important in this conversation, and she has one simple call to action. To lend your voice to the campaign, #KeepTheCare. Now, everyone knows that the United States healthcare policy is on the brink of change, and somehow, with that change, women's healthcare faces an unparalleled threat. Healthy Women is partnered with the DC-based MSL Group, who is providing pro bono services to launch the National and Education and Advocacy Keep the Care campaign. This campaign has one simple goal that I know all of my listeners can support: to demand that policymakers and healthcare insurers protect women's rights to equal, accessible, and affordable healthcare coverage. Now, to date, the Affordable Care Act, or the ACA, has enabled 55 million women in the United States to have expanded access to 26 critical preventive healthcare services. And I'm not going to list all of them, but they include everything we know and love, from pap smears to mammograms, breast cancer, chemo prevention counseling, and contraception, and more. These services benefit all women, from women of childbearing age to women at later stages in life, and the people who love them, at no out-of-pocket expense. Proposals to repeal and replace the ACA, however, risk turning over this care and taking it away. Now, while I told you 55 million is the most important number I want you to remember after today's podcast, when we look at women's health by the numbers, it's also important to note some also really important numbers. 44 million women are affected by osteoporosis. 59.5 million women a year are diagnosed with a sexually transmitted infection. 25% of all women die from heart disease, which is more than 400,000 per year. And more than 250,000 women a year are diagnosed with breast cancer. Now, while paying for healthcare is extremely expensive, paying preventive care saves billions of dollars per year. And I know we have all said this phrase, that it's not what you spend, it's what you save. We can save $322 billion a year for pre-diabetes and diabetes, $16.5 billion for breast cancer therapy, $4.9 billion for domestic violence care. And when we look at the subsets of women, the numbers are even more staggering. Now, before I go into all of that, I want to introduce you to our guest, Beth Battaglino. She's a working nurse, and she's worked in the healthcare industry for over 20 years, not only as a nurse, but also as a healthcare executive, helping to define and drive the public health education programs on a broad range of women's health issues. In fact, all the issues that we talk about on this podcast. These programs have covered everything from heart health to reproductive health, as well as programs that focus on aging well. Beth is responsible for setting the strategic direction of Healthy Women and building alliances with corporations, healthcare professionals, and consumer groups. In addition to her nursing degree, Beth holds degrees in political science, business and public administration from Marymount University and the University of Oklahoma. Please join me in welcoming Beth Battaglino. You are in the ladies' room. Hi.
Thank you. Hi.
What is on your forehead?
So today is Ash Wednesday. So during my lunch hour, I went to church and got my ashes. Awesome. And today is also Valentine's
I
Day,
know.
which is my national religious holiday. And I'm wearing red in honor of Valentine's Day. And I hope you can see the flowers behind me from my sweetheart and my children.
They're beautiful. They are beautiful.
Thank you. Thank you. So tell us about Healthy Women to start.
Well, Healthy Women has been around since 1988, and our core mission was always to educate women about important healthcare issues and really provide them the resources and the tools they need to have in hand in order to make a educated decision along with their healthcare provider on what options are best best for them, right? So
easy for you to say.
Easy for me to say, right? So it's always been very important to educate the consumer. And then in 2016, as healthcare became and as politics started changing, we decided that there was no better time for healthy women to get into the policy field. Mm-hmm. And I had no better person to help me do that but Phyllis Greenberger, who really is a powerhouse and has done so much in the women's policy and sex difference world, getting women included in clinical trials. So I thought timing's always, it's all about timing, right? Mm-hmm. So no better time than to bring Phyllis onto my team and to begin building a policy arm of Healthy Women. So
and
now
those people who don't know Phyllis, and it's easy to assume that everybody knows Phyllis.
That's true.
But for the 4 people who don't know Phyllis, Phyllis is the founder and was the CEO of the Society for Women's Health Research for over 25 years. I was on the board of directors of the society and was one of the early members. And actually, I told the story of the formation of the Society for Women's Health Research in my first episode of this podcast because I found out about it in a ladies' room. I was in the ladies' room at the American Medical Women's Association meeting in a stall, overhearing a conversation between 3 women. I didn't know who they were. They didn't know who I was, but it was about this egregious issue of not enough federal funding being dedicated to women's health research.
Right.
And as you know, at the time, only 13% of federal research funds were going to women's health research. So I, of course, being me, came out of the stall and just joined in the conversation. And they told me they were starting this organization. At the time was called Society for the Advancement of Women's Health Research.
Wow.
And they asked me to join their board. And I explained at the time I was a medical director of a pharmaceutical company, so that probably wasn't a great idea, but I would be happy to be involved, and got involved with starting the corporate advisory board.
That's
but
great.
Those 3 women turned out to be Florence Hazeltine, Phyllis Greenberger, and Susan Blumenthal.
There you go.
And there we were.
Trifecta.
In the ladies' room. So that's one of my ladies' room stories that
I love it. And that's perfect setup. So Phyllis came over to Healthy Women. We started a policy arm, and not only do we do the great job of educating women about all areas in women's health, we are now educating and raising awareness about preventative services and access to them. So services such as breast cancer screening, bone density, HPV, HIV, all are part of the mission and the policy drive for Healthy Women.
Yeah, I have to say, when I started this podcast, originally I was thinking, okay, I'm not going to get into politics and policy because I wanted to be very pure and just talk about women's health.
Right.
And I wanted to leave politics out of it. But I think if this year has taught us nothing else, if 2017, this past year, has taught us nothing else, it's that politics permeates everything. And that there is no point in us having this wonderful healthcare delivery system if people can't afford to access it. And I know there are people who are listening who have wonderful health insurance through their employers, and everything is fine. And I know there are people who are thinking, okay, boring, how does this affect me? Well, even if we just take a paradigm as simple as this horrible flu epidemic that we're in, and I apologize in advance if I start coughing and sneezing. If somebody can't afford to get either a flu vaccine or to get an antiviral medication if they have the flu, and they can't afford to take days off from work,
right?
Who do you think they're going to infect? That's a rhetorical question. I know you know that. But they're going to infect everybody who's around them. And that's the thing I think we have to understand. And I think that's so wonderful about this Keep the Care campaign.
No, the Keep the Care campaign couldn't have I mean, it was really the brainchild of one of my board members, Nancy Glick, and her great team at MSNL. And it really aligned perfectly with Healthy Women and our mission, and what Phyllis and I started mapping out as our policy arm. Educating women about the 26 preventative screenings that are now under the Affordable Care Act were so important, because most people didn't even realize that they were covered, right? So,
well, most people didn't even realize that the Affordable Care Act was Obamacare.
Exactly.
And that it was the same
right.
thing.
Talk about confusion. So I'm like, you know what? Disconnect, confusion, no better spot for Healthy Women, because that's what we do best, is take complicated matters and then slice and dice it so consumers can understand. But I agree with you. I mean, I never wanted to play in the policy field either. We did a great job with education, but policy, we need to educate women about policy and coverage, right? So
and how it
affects everyone, exactly, and their families. So I think your point well taken, but I think now we all know someone that has lost their job and are at an influx right now with healthcare coverage, right? I think we all can, if we take a step back, there's someone, whether it's our friends or family member, that has been affected with not having, or being in the middle with coverage, not having coverage, or now getting access to coverage because of the Affordable Care Act.
And a lot of people just think of this. I hear a lot of pundits framing this in terms of people who've lost their jobs.
Right.
But we're also talking about other huge groups, huge demographics. So people like myself who are very well employed, but are self-employed.
That's correct. Right.
Self-employed, and especially if we're over a certain age, cannot get commercially available insurance for less than an exorbitant rate. And I'm happy to share how much I pay. I pay $878 a month for bare bones insurance that does not include any other family members, just myself. Then there are kids who are just graduating from college, who are either still looking for jobs or who are in the numerous jobs that don't provide health insurance, whether that's flipping burgers part-time, or whether that's working in retail part-time, or whether that's trying to become an actor or an entertainer. Then there are the huge number of women who lose their health insurance through divorce. And their children who lose their health insurance through divorce. So, and then there are probably numerous other, subgroups that we can talk about. But somehow I think it makes people feel better if they have insurance, to think about all these people who are affected as others. And like, that could never happen to me. Yeah. Well, get back to me when your company undergoes a downsizing, or they cut back on their benefits.
Right. It's horrific. So I think, again, going back to Keep the Care and why this is so important. So educating, so it allows us to do a couple things. Number one, remind women the importance of taking care of yourself, and that preventative screenings are important and save lives. Number two, that they are covered right now under the Affordable Care Act, and there's 26 preventative care. And it is important to start raising awareness and making sure that these are not taken away from us, right? So those three align perfectly with Healthy Women's mission, our policy arm, which is access and safety, and the importance for us to have a voice.
That's extremely important. So tell me, when did the campaign launch, and what are the specific platforms and the specific activities of the campaign?
Yep. So we launched last year in May. We had our first Hill briefing in July, and it was a packed house. And I was, for the first time, it was just so fun. And so, I don't want to overuse empowering, but it was empowering to just see so many women in the room, and men.
And the opportunity use inspiring.
Inspiring is a good, inspiring. I like that. So inspiring. And to know that we were making a difference, and that what we had to say was being listened to. So that was the kickoff. I would say that was really our kickoff. And then in October, in New York City, we had a media briefing where we pulled in magazines, women's books, and really spoke to the importance of Keep the Care, the importance of the continued campaign. And we were able to share voices of real women who shared their experiences of how important and why it was so important to have these preventative screenings and what it meant to them.
So
and if they didn't,
tell me about some of those.
So one woman, and I think you're going to actually have her on your show soon, which will be great, Jenny, was sharing her story about she tested positive for the BRCA gene for breast cancer. And so she was able to have that preventative screening done. And now she's going to be undergoing a number of surgeries to have a double mastectomy. Young girl. I mean, this girl's in her 30s, has 2 young children. And it just makes you start getting the chills when you listen to her, but just it puts a face to the story, right? Where if she didn't have access to preventative screening, she could have died. And then when you look at cervical cancer and HIV and HPV, these are all covered under the Affordable Care Act right now, and women have access to it. So getting early diagnosis and getting the treatment and or preventing the disease from even beginning is so important. So those are the things that really make healthy women and my team and the need for this to continue so important.
So one of the things that's very frustrating to me is that a lot of people who I would consider naysayers think of the term women's health as a euphemism for reproductive health. And they think of reproductive health as a euphemism for, we just want everybody to have abortions. So can you talk to the issue of how the number of abortions has decreased dramatically?
Because the birth control being offered?
The introduction of the Affordable Care Act.
Yeah, no, I think, the whole idea of having access to birth control and preventing unwanted pregnancies is so important. And to the points that you just said, right? It decreases the amount of abortions. It's so important for these younger women to have access, not just younger women, all women to have access to birth control and preventative care services. And I think this day and age, that conversation, like we should look at a timeline and say, how proud we should be about where women's health is right now compared to even in the 1980s, when Healthy Women started, when the Society for Women's Health Research started. When I look at the timelines and see how women can actually say the word osteoporosis and understand that cardiovascular disease is the #1 killer of women now, and the great success that the Red Dress campaign has had, it makes me smile because we are making a difference. And so to take back everything that we fought and educated so much on from the late 80s to now, that would just be, it's just wrong.
Well, it's staggering. If you had, when I was in medical school in the early mid 80s, we used to say, maybe someday far off in the year 2000, we might have a vaccine to prevent cancer.
Right.
And now we have the HPV vaccine, which
right.
prevents most forms of cervical cancer,
right?
Which is just stunning. Because we think about it, still 4,000 women a year die of cervical cancer.
Right.
Of course, we've had great strides with over the past 60 years with Pap screening and Pap smears. But now we have an HPV test, which is much more specific for identifying women at risk or women who have pre-cervical changes. And I could go on and on about all of those things. One of the phenomena I've seen, and I don't know if you've seen this, with the Affordable Care Act being threatened by the current administration, I've seen a large increase in young women running to get IUDs.
That's interesting.
An IUD can last for 3 to 7 years without having to be changed, which is extremely cost effective if they're not having to pay, an upfront cost, which, women in your age group and mine had, that was a huge barrier.
It was a barrier. Yep.
Yeah, because it's a very large upfront cost and then no renewable cost. So these things are all, what I say to people who aren't that engaged in this topic is, if you're not interested in hearing about how it saves lives, let me talk about how it saves money.
Right.
And then I've got their attention.
No, I think, you're absolutely right. And I think that's so important. So bringing out the monetary or the financial, card, and then looking at how it can save lives. And it's a perfect formula. So this is a campaign that we're going to keep continuing on with. It's important. And it's just, right now, I don't see any end to it. Like, it's just, there's a need for the education. There's the need for, to make sure that women are taking advantage of these preventative screenings, and the importance of women's health as a whole.
So what kind of feedback have you gotten from the program so far?
You know what? We've gotten tremendous feedback. We've got some really good pickup in the media, which is great. We're seeing more followers on our site that are interested in policy, because we are not a policy website, but as you know, it is important as you're looking at different therapeutic areas in women's health, whether it's cardiovascular disease or breast cancer or bone health or cervical cancer, to understand that the preventative services, and that there is policy affects everything, right? So it's just educating consumers about policy as much or as little as they want, but more importantly, what they can do about it and how they can raise their hand and how they can be a little bit more proactive. And for us, that's a win.
Right. And how policy affects politics, and how politics affects our very healthcare.
Yeah, healthcare. It's all circle.
That we have access to, that whole circle of life thing. Tell me some anecdotes that you've heard from but you talked about Jenny, and I do want to just insert there. Obviously, we're going to be talking, she's the pro-driver. I love that term.
I know, that is a good term.
Talking to her, I'm going to be talking much more about that. I don't want anybody to have heard that anecdote, though, and think that if you have the BRCA 1 or 2 or 3 gene, that this is what you have to do. This is her choice.
Her choice.
And a choice, people also hear the word choice, and they think also it's a buzzword again for reproductive health. And they think it's a buzzword about abortion. First of all, I don't understand why everybody or so many people, not everybody, obviously that's a gross overstatement, but I don't understand why so many people hear the word choice and think that all women are going to make the same choice.
Right.
So certainly most women who have stage 1 breast cancer, who actually have cancer, will not require a mastectomy. So therefore, most women who have the gene certainly do not require a mastectomy. But like Angelina Jolie, this is the choice that she made because of evaluating her increased risk for breast cancer. But I certainly don't want anybody to think, well, I don't want this test because then I'm going to have my breast removed.
Right.
That's not how it works. And there's so many things in medicine that are choices. I had a great podcast interview with Leslie Jane Seymour in episode 4, where we talked about our choices for treating menopausal symptoms. And why would anybody think that all women would make the same choice? Or you brought up the Red Dress Awards. This is another great metaphor. I was sitting there and I was just overcome by the fact that I was at the first one, and now here it was the 15th anniversary.
Wow.
And talk about we've come a long way, baby.
Yeah.
Moment.
Yes.
I was also looking at this sea of hundreds and hundreds of women in red dresses, and no 2 women that I saw were wearing the same dress.
That's amazing.
It is amazing how many different red dresses there are. We all made different choices and I'm wearing a different red dress today. Turns out I have 7 different red dresses in my closet. Unfortunately, only 4 of them fit. But we all make different choices, whether it's about our wardrobe, whether it's about our contraceptive options, or whether it's about our menopausal care, or whether it's about preventive breast health, or what cardiovascular medicines we're going to be on if we need them for preventive purposes.
But the whole point is educating, right? Educating about the disease, understanding the signs and symptoms, and understanding your choices, and then being able to have that educated conversation with your healthcare provider on what treatment or role or whatever you're going to do is best for you. And we have those now, right? And how great is that?
That's awesome.
And the opportunity to now prevent so many diseases. So I think when we're thinking about Jenny, but I also, I'm thinking about a woman who was a kindergarten teacher, and she ended up having osteoporosis, but didn't realize it, right? So she ended up having a fall, just slipped and actually broke her leg. But it was through numerous procedures that she didn't realize she actually had osteoporosis. So now her voice and what she's sharing is the importance of prevention, and that osteoporosis is preventable. But if she didn't have the resources or didn't realize that maybe her grandmother had it or her mother had it, but thinking back on it, she's like, they did, you know? So now, you know, getting the screening done and making sure that, you know, people are more active about calcium and vitamin D and exercise and all those good things. They play such an important role. So, you know, osteoporosis can be completely preventable. So I think like when we talk about cervical cancer, when we talk about osteoporosis, when we talk about the importance of HIV and screening for that, HPV and the cervical cancer test, and mammograms and early detection for breast cancer, it all, you know, relates to living well, living longer, and it can be preventable. So I think this is so important.
So a couple of things I want to say about that.
Sure.
First of all, as you know, osteoporosis is one of my passions and has been for many years. Osteoporosis is also a great example, though, of different levels of prevention. And I think this is very confusing to people. So I just want to break it down.
Great.
First, we talk about primary prevention. Primary prevention is when you have no evidence of the disease. You may have risk factors, you may not have risk factors, but you're taking steps to prevent the condition from happening in the first place. All right, so with osteoporosis, calcium, vitamin D are extremely important. Weight-bearing exercise, extremely important. Knowing your vitamin D levels. You know, many women, 44% of women in Arizona, in a random study in a month, had inadequate vitamin D levels. And
in Arizona,
enough sun in Arizona, I don't know.
I was just going to say.
You're certainly not getting it in New Jersey.
Yeah, definitely not.
So of course, testing your vitamin D levels is extremely easy and extremely important. Secondary prevention is when you already have evidence of the disease, or maybe you have osteopenia, or you're almost there, you have low bone mass, but you haven't yet had a fracture. And you're taking steps then to prevent it from getting worse. Tertiary prevention is when you've already had some terrible consequence of the disease. So in osteoporosis, let's take this kindergarten teacher who already had a fracture. But there are still things she can now do to prevent it from getting worse. She's always going to have osteoporosis. Nothing is going to reverse that at this point once she's already had fractures, but she can prevent it from getting worse. And I think this is a thing that people in secondary and tertiary stages don't understand. They sometimes feel like, oh, you know, there's nothing I can do now. I have this terrible disease. Or people with heart disease are a great example. You know, 80% of our risk reduction, 80% of our risk for heart disease can be reduced by lifestyle and behavior changes, even once you've already had a heart attack. So, but I don't want people to feel like, oh, we just give up because now we have this disease. But it won't ever make it go away once you have it. So obviously, primary prevention is best. And so, again, if we ladder that up to keep the care, right? It's all about prevention. So I think, you know, I know it's easy to talk to you about it because you know so much about it, but I think it's important for your audience and the listeners to understand that these 26 preventative care screenings that are in the Affordable Care Act right now for women are important. And Healthy Women's mission under the Keep the Care umbrella is to educate women that they're there. Number two, to remind women the importance of taking advantage of them. And the third point is that we need to keep them. Right. So I think the most important thing is not to be overwhelmed by the fact that there are 26 things that you need to do.
I know.
Preventive health. So let's talk about tips for our audience. Okay. People are listening. They're saying, okay, Beth, I get it. I want to keep the care. I'm motivated to maximize my preventive care, but where do I start? What do I do? What are some of the tips here?
Sure. So you can
say for people who have health insurance.
For people with health insurance, okay, that's great. So preventative, make sure that you keep your annual women's wellness visit, number one. Make yourself a priority. So that's another thing that, Helping Women does, and we do it throughout the year, is remind women to put themselves first. And, I'm saying that and I'm kind of laughing because I don't think we'll ever put ourselves first, but I'll be okay with coming in number two, right? Being number two. So kids first, then you, and then everyone else. But, making sure that we keep that annual wellness appointment is so important. I think making time to get your mammogram, which is not, it's a separate visit, but it's important to put it on the calendar. And if you can put it on the calendar for the same time every year, whether it's your birthday, Valentine's Day, Halloween, whatever it is, just remind yourself to get your screenings done, because screenings save lives. Number two, find out more about, if you'd like to get involved with policy, there's so many great sites and so many great groups that are doing some fantastic things. But you can visit healthywomen.org or Keep the Care, and learn more about what you can do in your own state. And I think that's important too. And then understand family history. I think it's so important to have that conversation with your mom, your grandmother, your dad, and find out what possible, what their family history is. Is there a history of osteoporosis in your family? Is there, do you have a history of heart disease? Is there a history of cancer? Because understanding those family history and the risks that could prod you to take a little bit more active, be a little bit more active or proactive in your care.
But at
I
the
think
same
that's really
time,
important.
the flip side of that argument that I always, want to make
Go ahead.
people know, and you know what I'm going to say, is that if you take something like breast cancer,
right,
the overwhelming majority of women who have breast cancer have no family.
Never. That's right.
No, I don't want people to think, while it's very important to know your family history,
right,
I don't want anybody getting some false sense of security. I cannot tell you how many times somebody who was diagnosed with cancer has said to me, I don't know where this came from. We never had cancer in my family. And I'm like, well, you do now.
Yeah.
And the other thing is that many of us come from families where our grandparents or parents or siblings died at a much younger age from something else.
Right. Diabetes or
a car accident.
Before
they, or a gunshot wound, or, being in the military, or, any other kind of thing before they were at the age where they might have developed these kinds of things. Obviously, there's certain conditions, like both of my father's parents died of lung cancer, and they were big time smokers. So obviously, I don't have that risk factor in my life. So it doesn't really count that they got lung cancer. I'm not at risk for lung cancer, although of course,
I was going to say,
women
lung
cancer have no smoking history.
No smoking history, and lung cancer is being diagnosed in women at a much younger age now too, which is just,
it's staggering. The good news is that most people have gotten the message about decreasing smoking. The bad news is the only group that is continuing to increase smoking
is younger
teenage girls.
I know.
So, they're they think it's cool still. I don't know how that happened. And they think that it will help them with their weight management issues. But there are certainly much healthier ways. And I also say to these teenage girls, how do you afford that? Smoking is extremely expensive. Where do you get money?
I have no idea. And you need to do a show on the vapor cigarettes that I'm seeing now too. That's driving me crazy.
I don't understand that.
Me neither.
So as far as other tips, so you mentioned, scheduling your annual visit. What I always tell people is the reason it's called annual is because you're supposed to go every year. I schedule it on my birthday. I don't go on my birthday, but that's when I make the phone call.
Me too.
On my birthday.
Yeah.
And I consider that my gift to myself. What I also started doing, since we're in the age of social media, I started tweeting out when I have these tests myself, just as kind of like, okay, I'm doing this. You should do this too. So I'm tweeting out when I had my bone density test, which not all women need, and certainly not need every year. And this is why it's important to have your annual wellness visit to talk about what do you need.
Right.
I tweet out when I get my vaccines. All right. We've had some new vaccines and some new vaccine recommendations. Just yesterday, we talked about shingles. that's something that's part of that conversation.
Right.
I tweet out when I have my mammogram, and once every 5 to 10 years, I'll tweet out about my colonoscopy.
No, but I think, so the whole idea of putting a real women to real stories, I think is just so important. And it makes us say, oh yeah, well, Dr. Donica did it, I'm going to do it. Or it makes me think like, oh, she went to get her mammogram, I need to schedule my mammogram too.
Yeah, I had some comments and feedback from people who used some expletives about, oh, damn, I forgot to do that.
That's okay too.
One woman said, I forgot to get my mammogram, but I did get my teeth cleaned. And I had to laugh because I actually just happened how the scheduling worked out. I actually that day had gone straight from my mammogram to the dentist for my teeth cleaning. But I didn't tweet about that for some reason. I didn't think that was, I don't always think about dental care.
Oral care.
As an important part, even though I do it.
Right.
I don't think about it. And I know lots of people don't think about how integrally important it is for our overall health.
Right.
And the connection between oral health and heart disease.
Right.
Stroke. So anyway, any other tips that you have for our listeners?
Yes. So keep the care, healthywomen.org, or visit, there's so many other great women's health sites. So if, American Heart Association's doing some great things. We have the Black Women's Health Imperative, which is doing some great things in policy and health overall. So think about, some of the sites or the organizations that you do like to go to visit and see what they're doing in policy. But overall policy, preventative care, and understanding the 26 important screenings that are now covered under the Affordable Care Act. You can find it at healthywomen.org's campaign called Keep the Care. Again, we did it in partnership with MSNL, and it's a program that we're going to keep going with.
Well, I am going to tweet about it as soon as we get off.
Thank you.
Before I let you go, I ask everybody some questions.
Sure.
Because they're just fun. What is what has been your most interesting, unique, or memorable experience in a ladies' room?
In a ladies' room.
I shared with you my story about, being
yes, the whole
Society for Women's Health Research.
Yeah, I'm just thinking, this was it wasn't really a story, but it made me laugh and realize how that children are sponges and they learn by seeing, right? So I was in the ladies' room about a few months ago, and there was two little girls, and they were kind of helping each other out, and you could tell it was probably their first. The mom just let them go by themselves for the first time, and the older sister said to the little one, and one was like 5 and the other one was like 6, and the little girl, the 6-year-old, said to her, "Don't forget, we need to wash our hands. It's really important because we carry germs and we need to get rid of the germs." And they both were singing like "Happy Birthday," washing their hands. And I'm like, awesome. That is awesome. And that is exactly what we need to do with all these little ones and adults too. But the importance of starting young and the importance of educating on the importance of hand washing and germ prevention is really important. So,
and that's an extremely important message now during flu season.
Flu season. That's why, So that was a fun one.
And one of my favorite questions that I love to ask all our guests is, now that you're a certain age, if you could give one piece of health advice to your 21-year-old self, what would it be?
Use sunscreen. Laying on the beach all day with like bain de soleil is not a good thing. So the importance of sunscreen, even if it's cloudy, use it.
And actually, we were talking about vitamin D earlier. And one of the issues is, the good news is that more and more women are using sunscreen. The bad news is that is decreasing our own vitamin D production from the sun.
Seriously, we can't win on that one?
Well, you can win by putting on your sunscreen and taking your vitamin D supplement and getting your vitamin D levels checked. And then finally, we do have a lot of listeners who are men. So what is the number one thing you want men to know from this discussion?
From keep the care conversation, or just overall? I'm
going to leave that up to you.
Leave that up to me.
Totally open-ended. You could do either or both.
Okay, let me think.
Because we're all about choice here.
Right. You know what? Men need to start taking charge of their health too, and not always relying on women. So you can schedule, and I'm really good at this because I let my husband, I'm like, you can schedule your own appointments and keep your own screenings. I have enough to do. So my little shout out would be men. You all need to start taking care of yourselves too, and not relying on your wife or your significant others to do it. And preventative screenings are just as important for you as they are for women. So we're all in this together.
Yeah, and I think as far as tying that into the Keep the Care campaign message, what I would like men to know is that even though we're talking about this in terms of preventive screenings for women, preventive screenings for women benefit you. I am so angry with these congressmen who have said, why do I need to pay for maternity care benefits? I'm not ever going to have a baby. No, but 100% of our future citizens come from women who have needed maternity care services.
Right.
100%. There's very few things in medicine that are 100%, but that is one of them. And
yeah.
Obviously, in terms of infection control, whether it's sexually transmitted infections or infections like the flu, that certainly affects you. And then in terms of the cost of care, any preventive measures save us, billions of dollars, as I said in the intro.
That's right.
In terms of preventive, and in terms of saving money from treating illnesses once people get them.
Right. No, absolutely right. So when you start putting the dollar sign behind everything, then you do realize that you do have a hand in the game, and it is important.
And these women can be we've heard lots of people talking about as a husband, as a father, as a brother, but also these people are your fellow citizens, your employees, your employers.
Right.
Certainly anybody who works for a woman employer is not going to be too happy if she has an illness that she's not going to be able to work anymore. And, it's, if you want to talk about a trickle down effect, this is the true trickle down effect that we should be talking about.
Yeah. No, I couldn't agree more.
All right. So tell everybody again, the hashtag and the website.
So the website is healthywomen.org, and the hashtag is #KeepTheCare.
Okay. Thank you so much. It's always a pleasure talking to you. And I know everybody is really, really going to benefit from this.
I think so too. Yeah. Thank you. Have a great day.
Take care and keep up the good work.
Thank you very much.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook @Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.